Hi, I'm Dr. Rahman, and I want to talk about sex. Sex is one of those taboo issues. They've done a couple studies, and they say women come to the gynecologist and they expect the gynecologist to ask them about their sex life or their sexual dysfunctions, if they have any. And doctors, on the other hand, feel as though if you're having a problem with sex, the patient will mention it. And so the net result is nobody talks about it. And what we know is that it is not uncommon for women to have low libido. It is not uncommon for women to have difficulty achieving an orgasm. And as women get older, it is not uncommon for women to have vaginal dryness, pain with sex. And so what I would say to you is, yes, there are sex therapists. There's couple therapy that a couple might want to engage in, or an individual might want to engage in, particularly if she has been a victim of sexual abuse or molestation in the past. But I also believe that one part of the evaluation should include a visit with a gynecologist to confirm that there's nothing going on from a gynecologic physical perspective that might be interfering with her ability to enjoy her own sexuality.
What are some of the common causes of low libido, or do they vary?
It probably varies. It says that the problem with low libido has to do with what's going on between her ears.
Mm-hmm.
The problems with pain with sex has to do with what's going on between her legs. And so a lot of times with low libido, for the simple one is for that busy mom that has children, that's working a job,
mm-hmm.
that is overwhelmed. Sex is maybe the first thing that goes out the window because it's expendable. I mean, so she just may be tired,
mm-hmm.
And not have the energy after a long day at work, dealing with the children, washing clothes, cooking meals, to feel like a sex diva. And so it may be as simple as things like date nights or blocking out time when she can just devote to herself. I think it's very important for women not to drain the well, to learn how to feed into themselves, to give themselves the time, the space that they need. So that's kind of an easy fix, but hard to do. I mean, hard to do when you're busy, because trying to figure out what's expendable.
Yeah. Are there any common conditions that cause low libido besides, mental health? Are there any common gynecological conditions that cause low libido?
We know that sometimes with women who are on certain medications, and the one that comes to mind is antidepressants, have been associated with decreasing a woman's libido. If a woman has some sort of hormonal imbalance, i.e. like a thyroid dysfunction, that might. So that's why you don't necessarily assume that it's all mental. She does need a physical assessment, mm-hmm. to rule out other possibilities, but a lot of times it is everything that's going around, mm-hmm. In her world.